And maybe the very first point I should make is that I always say to people when I see them with their dog or their cat who's got itchy skin is that it can be an incredibly frustrating condition to get to the bottom of and to treat.
This is the time of year where we start to get really itchy dogs and cats. So if your pet is suffering from any kind of itching, scratching or skin condition, you need to check out this episode.
Welcome to Call the Vet, the show that answers all your dog and cat questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Welcome to episode 64 of the podcast that takes all of your dog and cat health questions and gives you actionable, evidence-based answers. So if you've not met before, my name is Dr. Alex. I'm a companion animal veterinarian in general practice and also the founder of ourpetshealth.com, where my aim is simply to help you and your dog or cat live a healthier, happier life. And today I'm doing something a little bit different. I'm actually taking the audio from a live stream that I did a little while ago now about beating the itch. Now, live streams like this is something that I do occasionally over on YouTube or Facebook, but I also do a monthly live stream with Q&A session over at the Our Pets Health Academy. So this is the one place where you can go to access lots of different courses, actionable downloads in a resource library, this monthly live stream with Q&A, as well as a member-only forum to interact with your fellow pet lovers, get your questions answered, share your experience, and get support from everybody. So if that sounds like something you're interested in, definitely head over to ourpetshealthacademy.com and you can find out all the details there. But for now, let's jump into the show.
But let's start off by saying kind of what itchy skin, or describing kind of what the causes of itchy skin are. So as you can imagine, there's an awful lot of different causes. And maybe the very first point I should make is that I always say to people when I see them with their dog or their cat who's got itchy skin is that it can be an incredibly frustrating condition to get to the bottom of and to treat, because there's lots of different things involved. Not all dogs will and cats will respond to the treatment as we would like them to. And so that can mean that we need to go through a number of different treatment trials, some of which can take 2 to 3 months to see the full benefit of. So it can be very frustrating. And also there's not really any fantastic tests to specifically look at the individual cause of that itch. There's definitely things that we can look for, but it can be frustrating first. Reaching that diagnosis, so getting the right diagnosis in the first place can be frustrating, and then finding what the ideal treatment is. So causes of itchiness in dogs and cats. Now, number one has got to be parasites, and here really fleas is going to be the most common. It's amazing how often this is actually the problem. If your dog or cat hasn't had a recent flea treatment, even if you can't see fleas, then definitely consider getting a treatment onto them with a product that works. I've done several videos and blog posts and things like that about the best flea treatment for your dog and cat. I'll link all of these things in the description once this video is finished, and I can kind of tinker with that description. So I'll leave all the links to everything I talk about there. But yeah, fleas are very, very common. They are a year-round problem. So for those of you in the Northern Hemisphere in spring, in autumn, there definitely will be fleas. Even in winter, even when it's cold, fleas are a problem. Our houses are better insulated and they can survive year-round. Also, with climate change, you know, the weather is becoming warmer. Certainly I know here we haven't really had kind of the really cold spell. So I've been seeing fleas all the way through winter, which I'm just coming out of. Maybe not quite as regularly, but you know, almost every week I'm seeing a case of fleas. And you know, to be honest, if you're going to your vet and they're diagnosing with fleas, it can be really frustrating for you because it's a very simple fix. Also, as vets, we do. Fleas are the stinking worst. They absolutely are, because once you've got a problem with fleas, it can take a long time to get on top of that problem. But you know, I'd say as vets, we do recommend year-round flea prevention. And so it's very frustrating if you're going to have to spend a consultation fee, which is often, you know, not an insignificant amount of money, just for your vet to run a flea comb through your pet and find evidence of fleas. So I've got a post about how to check your cat for fleas, but you're not always going to see adult fleas on your pet. You will when there is a really severe infestation, but they're fantastic at hiding, especially if you've got a dog or cat who's black or brown, has kind of got dark fur. They really hide, and it can be very difficult to actually see the adults. They move incredibly quickly as well. What you're looking for is little kind of black specks, dark brown specks in their coat, and that's flea dirt. Now, the best way to look for that is actually to get a flea comb. They're really inexpensive. If you've got kids, you might have a knit comb, and that does the same thing. It's just a really fine toothed comb. Brush that through their hair, pop it on a bit of wet kitchen roll or cotton wool or something like that, and give it a rub. And if it's turning a reddy rusty kind of brown, browny red, then that's flea dirt. Your pet has got fleas, even if you can't see adults. Definitely get them treated. But if you haven't treated them for fleas recently, you can't see that, but they've just started to itch, definitely something to consider. So fleas are one type of parasite that can cause this problem, can cause itchiness. The other main type is mites, and there's a couple of mites that we think about. The main one is going to be scabies, Sarcoptes scabies, which is a mite. It burrows into the skin. It kind of makes tunnels within the skin. It's incredibly itchy. You'll find your dog, it's more dogs really, you'll find your dog is kind of scratching just non-stop, and they can often get quite crusty lesions. They'll get hair loss, and they'll just be going absolutely crazy. Now, it's not super common. Maybe depending on where you are in the world, it's more common. I thankfully don't see it a huge amount. In the UK, saw it a lot in foxes. We saw a lot of wildlife, and I saw it a lot in foxes. So there's definitely a wildlife reservoir there. And yeah, how do we go about diagnosing that? Well, your vet will take what we call a skin scrape. So they'll get a scalpel blade and they'll scrape that against the skin backwards and forwards until they're getting what we'd call a capillary ooze, which is where we start to get a little bit of kind of bloody fluid coming through. That says that we're deep enough. We then look at that under the microscope and we can see all of these little creepy crawlies if they're there. Now, the problem with mites, and there are other mites that can cause problems as well, is that if you see them, certainly with sarcoptic mange, the mange mite, if you see it, then you can say it's there and it needs treatment. But if you don't see it, it can be quite difficult sometimes to get that positive diagnosis. So a negative result doesn't necessarily mean that it's not causing the problem. So if your dog's or your cat's got all the hallmarks of having a mite problem, so a mange or another mite, then actually treating them might be the best idea when it comes to kind of ruling that out as a cause of problem. We'll go on to treatment of things later, but really with parasites, we're very lucky that we now have some excellent treatments against mites. So that's both sarcoptic mange, but also Demodex, which is something that you might have heard of. That's something that actually, it normally lives in our eyelashes and eyebrows and things, which is a little bit kind of weird when you think of that. And it is a normal thing in dogs, but for some reason, in some dogs, it will overgrow. In itself, that's not itchy, but that then allows secondary infections and things like that, which then become itchy. So we need to treat that. But anyway, we've got some great treatments for mange and other mites now. So that's the isoxazoline class of drugs. So those are things like Bravecto, NexGard, Simparica. They do a fantastic job, whereas our older chemicals, our older parasite control products were really not as effective, and certainly you couldn't have quite as good a confidence that it was working, and it would take longer. Certainly with Demodex, we used to have to wash our dogs with something called Amatraz, which was horrible, stinky stuff. You have to do it really regularly. It's a nightmare to try and treat. But now we've got these other drugs. So Bravecto is something that comes up quite a bit if you're looking online about causing seizures in dogs. Now, that is one of the potential side effects of the isoxazoline class of drug. The incidence of that is really, 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 really small. I've written about that. Again, I'll leave the links down in the description at the end of the live stream. But it's things that you should be aware of. Equally, I always say this: anything that we give, any intervention that we do, any health decision that we make for our pets at all, whether that's what to feed them, whatever, there's going to be pros and cons, risks and benefits. Hi, Georgie. So really pleased that you could join us, because I think it was you who asked kind of to talk about itchy skin. So yes, I'll leave the links to that, but we need to be mindful that anything that we give does have potential side effects. Generally, the benefits massively outweigh that risk, and generally that risk is really, really tiny. So don't be scared to use these products when they're needed, because they make a big difference, and without them we're really going to struggle to treat that mite infestation properly and appropriately. So that's mites, and that's kind of really parasites. Now, it might be where you are in the world, there are other parasites that can cause itchy skin, things like bot flies and all kinds of different things that I've never practiced in a kind of a more tropical climate. So, definitely be aware of what parasites are in your local area. Your vet will be able to talk to you about that, and will probably be recommending kind of preventative treatment or strategies that you can take to try and reduce the risk of those. But so parasites, number one cause of itchiness in dogs and cats, really. Now, the next most common is allergies, but I'm actually going to move allergies right to the end because it's kind of probably our biggest topic here. And so the next one I want to talk about is just skin infections. Now, skin infections can definitely cause itchiness. We need to be aware that very often there is an underlying cause of that infection. So the infection isn't the primary problem. It wasn't the first thing that happened. There was something else that happened that then allowed an infection to take hold and to become a problem, and to then cause cause that infection to overblow and to cause that itchiness. So Georgie, I'm at my wit's end. Meg is itching again, no fleas, etc. Vet said give her Piriton. So maybe we'll come. So that'll probably be allergies, Georgie, if that's what a Piriton is suggesting, I would imagine. But we'll come on to that, and we'll definitely cover a lot of ground about allergic skin disease. And absolutely, you're at your wit's end. I said at the very beginning, skin conditions, skin disease, itchiness is incredibly frustrating for all involved as well. It's not just the pet owner, it's not just you, it's not just your dog and your cat who is struggling. As vets, it can be incredibly frustrating for us as well, because we really want to give you a quick fix. We want to give you something that will work, but unfortunately, we do sometimes just have to work through that process. And unfortunately, not every pet reads the textbook either. They don't necessarily respond how we would like them and how we would expect them to respond. But infection, so we need to be mindful that a lot of the time that there's an underlying problem, and that might very well be allergic skin disease. It might be that actually there's just been a little scratch, there's been an insect bite, there's been something like that that's then caused some damage to the skin, a bit of an abrasion, a bit of a knock or what have you. That's allowed the normal bugs that are growing on your dog's skin in their coat to overgrow, to cause an infection, which then needs to be treated with the appropriate treatment. So that infection could be bacterial, in which case you'll need an antibiotic. Often that's a staphylococcus infection, or it could be a fungal infection. So malassezia is the most common one here. We get an overgrowth, and with that you'll often get a real greasiness. If you feel your coat, your dog, especially your dog's coat, you'll get a really greasiness to your fingers. It also has quite a distinctive smell, which if you're with your dog all the time you probably won't notice, but certainly when I see some dogs come into, or when I smell some dogs come into the consultation room, I can smell that problem, and I know as soon as I smell that, if I touch them, it's going to be greasy, and if I look under the microscope, I'm going to see that fungal overgrowth. So we need to treat appropriately. Now, that could be with, if it's just a very surface infection, it could be just with topical treatment. And actually, very surface skin infections, topical treatment works just as well, if not better, than oral systemic medications, so tablets, capsules, that kind of thing. But also, it's much better use, it's much more responsible use of our antibiotics. So you'll be aware, I'm sure, that there is a big problem with resistance to antibiotics, with antibiotic resistance, and we want to be using our antibiotics responsibly. So for surface level infections, we can treat very effectively with products that contain things like chlorhexidine. Is a really good one. There are various other ones as well. So it might be that you just get a cream. It might be that a shampoo is more appropriate. That kind of thing. For deeper level infections, you're going to need tablets, and certainly for significant fungal infections, those can sometimes be needed for a long time. As a general rule, though, even for a bacterial infection that's a little bit deeper, the general recommendation, certainly by dermatologists, is that we treat for a minimum of 3 weeks, because what can happen is we can get visual cure, so it looks like the infection's gone if we're just using our eyes, but actually to get proper cure of that infection, we need to treat much longer than that visual cure, and that's generally 3 weeks is the recommendation there. Now, other things that we get if you've got a thick coated dog, so some kind of Labrador retrievers, that kind of thing, they can get something called a hot spot, which is where they get kind of moisture trapped by their skin. They get a bacterial infection, and it goes from being nothing to a massive problem, incredibly itchy. It's a patch. It's often on the side of their face, maybe their neck or their shoulder. It's incredibly sore, it's incredibly itchy, and yeah, it's really moist, it stinks. They won't let you touch it just because it's so sore, and it can become a real problem very quickly, like I say. Now, if that's the case, we're going to need to do all of these things that I've talked about, but also maybe clipping that coat if your dog will let you as well, or if your dog will let your vet, because you really are going to need to be taking them to the vet to get the appropriate treatment. So infections, next cause of itchiness in dogs, along with parasites. I've then got kind of skin problems in general, which is it's kind of a little bit of a cop-out because it covers a whole load of different things. Now, that could be your dog has got a problem with scale. They've got a very scaly skin type and they need treatment for that. They're scurfy. They've got quite a greasy skin. It could be they've got kind of another problem. It could be they've got a hormonal problem that's causing issues with their skin that's then causing them to itch, for example. So, that's certainly something that could be going on. We've got anal gland disease next. Now, if your dog is particularly itchy, if they're nibbling around their bum, their back end, their tail base, that kind of area, if they're scooting their bum along the ground, that they don't always do that. So don't take that as a reliable source of a sign that they do have anal gland disease. But if they're doing that, they're kind of targeting that particular area, then anal glands that have become more full than normal, they become stretched, they're irritating, and so your dog will be kind of chewing and scratching to try and relieve that irritation. That's the only way they know how to try and do something. It's just like us scratching a particularly itchy spot. Seeing your vet, they're going to be checking the anal glands, definitely, if they're just targeting that one particular spot, and then giving the treatment that's needed. Now, you can also get anal gland abscesses, which you'll see clearly if you kind of lift up your dog's tail. Cats can get these as well. It's not so common. Anal gland problems aren't so common in cats, but they definitely can. That's something that it may be a regular problem. So the pets that get this anal gland disease, it might be something that's just a one-off or every, once in a blue moon, but it might be a regular problem. And some animals will need their anal glands expressing on a very regular basis. There are things that we can do, kind of high fiber diets, different things that we can do to try and reduce the chance of that, and to investigate that as a problem more. But definitely we need to be thinking about anal gland disease. And then I guess the final one before I then go back to allergies is going to be, is your dog actually itchy? Now, that might seem like a silly thing to ask, but for example, if your cat is just licking themselves all the time and they're licking themselves bald, we'll think, well, they're itchy, but it might be that they're just anxious, they're stressed, and that's causing them to lick themselves like that excessively. That then releases endorphins, so it makes them feel a lot kind of happier about life, albeit for a short period. But they can strip themselves bald completely. You're so thorough. I keep typing out questions and then deleting them because you're already answering it. Great to hear. But yeah, keep those questions coming. And if I'm not answering it now, and Georgie's on Facebook, this is question. Patrick is on YouTube. I'll try and get to them at some point. I'm hoping to cover everything. There's a lot to cover, so I'm kind of aware I'm probably talking quite quickly as well. But anyway, we'll try and get through everything. We want to be sure that your pet is actually itchy. So cats, it can be stress. It could be pain as well. So if your pet's got arthritis, for example, in one joint, then they might be licking that one particular joint, and that might again release endorphins, and help them, albeit in the short term. Dogs also, if they're bored especially, but also if they're anxious, they'll lick one spot. Often they'll get something called an acral lick granuloma, which is what we call it, and you might see it because it's often on the kind of the inside of their wrist. If you imagine this as your dog's hand, kind of on the inside there, they'll get it's like an ulcer, but it's not as red and raw necessarily as another ulcer or a mass. It will become thickened as your dog does it for longer. That can be a sign actually of boredom and or stress as well. It can definitely cause itchiness once it reaches a point, because it will then develop an infection, which we may need to treat. But there are underlying problems as well. So it might be that your dog or your cat isn't actually itchy at all, and there is another problem. They're painful, or they have got some kind of behavioural problem, if you like, be it that stress or boredom or something like that. Excuse me. Okay, and so before I get into allergies, and I meant to do this at the start, for those of you who aren't aware, I've got a charity calendar that I've done for the first time this year. If you head over to ourpetshealth.com /calendar or /calendar preview, but if you go to the main page, there we go, you can see it there. It's got, it's my charity calendar. So it's supporting 20% of all proceeds are going to help support the charity Tree of Life for Animals. It's called TOLFA, and I think it's tolfa.org.uk, but the links are all on the site. So that's a fantastic charity over in India, in Rajasthan, in kind of northwest India. It does a fantastic job. It helps with population control, with street dogs and cats. It helps with the eradication or the control, at least, of rabies. They see dogs, cats. They see horses, camels, monkeys, you name it. They do it, and they perform a crucial service in that part of the world, which otherwise isn't well served with veterinary services. I was fortunate enough, I think it's about 10 years ago even, to spend a month working there and seeing firsthand what they do. So yeah, definitely, if that's something you're interested in, it's going to make a fantastic gift for Christmas, if I can say Christmas. We're in October, so I think I'm safe. So yeah, definitely go and check that out if that's something you're interested in. But anyway, I meant to do that at the beginning. Let's move on to allergies and allergic skin disease. So this is really the big one, isn't it? So there's a couple of different, there's three main, if you like, kind of types of allergy that we get. So we've talked about fleas already, and flea allergic dermatitis is probably the most common cause of allergic skin disease in cats, certainly, and probably in dogs as well, or at least in part in dogs. And while fleas in general will cause itchiness, so, your dog and cat will get bitten. If they're getting bitten enough, they're going to be itchy anyway. With dogs that are allergic and with cats that are allergic, they're actually allergic to the saliva of the flea. So in really extreme cases, and again, we see this more in cats than dogs, or certainly I do, one single flea bite can absolutely set your pet off itching like mad. So it seems like a really minor problem. It's a single flea bite, but the response is just crazy. They'll come up with ulcers. They'll get something called miliary dermatitis, cats will at least, where they get lots of little scabs all over the body. You pick the scabs off, they're not particularly inflamed, and they're really kind of tiny scabs. Often it's over their back and around kind of their tail base, which is often where fleas like to live, or certainly where they can't be groomed off as quite as easily. And your pet will be going absolutely crazy. So for animals that are allergic, this is one reason why it is absolutely crucial to keep up that flea prevention year round, because it could take a single flea bite just to set your pet off and be absolutely miserable because they're so itchy. So flea allergic dermatitis, incredibly common allergy for those pets, dogs and cats that are allergic and have allergic skin disease. The next most common one is going to be atopy, so atopic dermatitis, which is, I liken this to like hay fever for dogs and cats, in the sense that it's an allergy to the pollens, to different things that are in the environment. It's not always pollens, it can be dust mites, storage mites, all kinds of different things. But pollens are a big one, which is why we tend to get it more as a problem in spring and maybe in autumn as well, when things are going to seed. But rather than hay fever, where we get kind of snotty and watery eyes and all that kind of thing, dogs and cats, they get itchy skin. Now, there's a number of kind of hallmarks of this that make it much more likely to be the case. And we think of this as face and feet. So we'll often get dogs, again, especially dogs, who will be chewing their feet. They're not necessarily itchy anywhere else, but they're always really chewing their feet. The classic here is our small white, kind of furry, white fluffy dogs. So our West Highland White Terrier, the Westie, is a classic example of this, but our small white breed dogs really are prone to this. But they'll come in and they'll have saliva staining all over their feet. So rather than being a nice white, it will be kind of a brown staining. That's a classic sign that your dog has been chewing and licking their feet kind of on a longer term basis. So yeah, we're also kind of face as well. Now that can be just ears. So a recurrent ear problem is going to, be a trigger to think that there is probably or possibly or more than likely an allergy and an allergic component to the problem that your dog is suffering from, even if they're not itching anywhere else. But so it's an allergy to the pollens and all that kind of thing that are in the environment. And then the final one is a food allergy. So food allergies is something that is often talked about as a really big cause of allergic skin disease. I don't think it's as common as a lot of people, certainly a lot of forums make out. And, what that allergy is to, well, actually, chicken, beef and fish are the most common protein components that our dogs are allergic to. And it's very much more likely that it's the protein part of the diet rather than the carbohydrate part of the diet. So grains, and I don't want to get into a big discussion about feeding and all that kind of thing, but grains are kind of public enemy number one, if you like, on the internet when it comes to feeding your pet. Oh, look, I'll just show you. We've got Millie, who's just wondering what I'm up to. So I often shut the door when I'm recording these, but anyway, we'll let her have a little sniff around. She's wondering what's going on. On a lot of things, grains is given a really bad rap, and I've actually written extensively about kind of the potential benefits of grains, how dogs aren't wolves and can process. They have had evolutionary changes to be able to utilize grains and things like that. Hello, Millie. Yeah, I think she got scared. She's snuck off now. Molly might be around soon anyway. So I've got two cats. They look pretty similar and my kids can't actually tell them apart yet, although, they're not that similar. But anyway, so grains, absolutely, they can be a cause of allergic skin disease. It's often, it's not often, they're not very common. It's kind of the fourth or the fifth most common cause of food allergy, but food allergies really aren't that common in the first place. So it's going to be a really small percentage of dogs who are itchy, who have a food allergy, and it's going to be even smaller percentage who are allergic to grain. But if they're allergic to grain, they're not actually allergic to all grain. They're allergic to a particular type. So that could be barley, it could be wheat, it could be corn. It's going to be to one particular type. So that's food allergies. What can we do about treating that? Well, first up, trying to get a diagnosis this is where it can get a little bit challenging, because obviously if a dog's or a cat's got an allergy, a skin allergy, it's not necessarily going to be to just one thing. So it's not going to necessarily just be to that one protein component or that one grain, if you like. It's not going to be just to fleas, or it's not going to be just to a single type of pollen, a single species of tree or bush or whatever. They're potentially, and I suspect they're likely to be allergic to a lot of different ones. So this is where it can get really challenging. So with a flea allergic dermatitis, we can just maintain our flea treatment, and if that helps control it and it stops it coming back, then great, that's kind of given us our diagnosis. Now there are some flea treatments that are much better than others when it comes to giving them to a pet with a flea allergy, because they will also help to control the fleas in their environment. So the product will also be in their dander, so their coat and their skin that gets shed, which will help control the population, which will help prevent any flea bites in the first place. Because you can appreciate if the product needs to work, or if the flea needs to feed to get the product to then be killed, that's not so great if it only takes one bite to really set your cat off. So there are definitely better products than others. Talk to your vet about that. I've got those other articles that again I'll link to. So that's flea allergies. Now with atopic dermatitis, there is a blood test that we can run. It is quite expensive, depending on where you are in the world. And very often we'll actually be working on a suspicion, we'll be ruling out other things. So we'll have done our skin scrapes to check for mites, we'll have done tape strips to look, and hair plucks and things like that to look for signs of infection, treating that as appropriate, and then we'll be left with allergic skin disease as the most likely thing, and then we'll give a treatment trial to see if that helps control the signs. We're very lucky, again, kind of having spoken about the isoxazoline class of drugs with mites, we're very lucky that in the last few years we've got some fantastic drugs to treat atopic skin disease. So we always used to use steroids. That was what we had to use. Cyclosporin was another one. Atopica was another one that we'd use, but that wasn't fantastic. And potentially, that was very expensive as well. It wasn't hugely successful. Although it does work in a number of dogs, it's still available. And if your dog's on it and it's working, fantastic. But steroids was the mainstay. Now, steroids are fantastically cheap and they work really well at reducing itch, but they have a whole kind of side effects, especially if you're on high doses for a long time, which often are allergic skin disease dogs need to be. It's a bit like having a sledgehammer to crack a nut, if you like. It has a lot of knock-on effects. It can cause hair loss, it causes pot belly, weight gain, increases risk of cruciate disease, maybe diabetes, urinary tract infections. Yeah, steroids, can have a whole load of side effects. Short-term use, not a problem. Generally, short-term use fantastic, and it is really effective. And sometimes it's what we need to give if you're, for example, your dog's got really bad ear disease. Steroid, there's nothing like steroids to help open up those ears, reduce that inflammation, reduce the discomfort, and get that treatment on board, the topical treatment. But we're lucky that we now have other options. So our other options are Apoquel and Cytopoint, which is the newest one. So Apoquel is a tablet. It's very much more targeted to a specific receptor that is associated with itch, and especially itch with allergic skin disease. So it's much more targeted, does a fantastic job. It does have an anti-inflammatory effect, which is important, especially if we're thinking about treating a dog when they're coming in with a real flare-up of their disease, if they're not under any other treatment and their skin is all inflamed. It's definitely a brilliant product. We start off at a higher dose for a couple of weeks. We then reduce it down to a maintenance dose. It's pretty safe. There's no real major concerns. We can't use it in dogs that are younger than a year old, or older dogs, or any dog that has got cancer. And really that's more of a theoretical risk, as I understand it, rather than a proven risk. But it's a precaution that, if your dog falls into one of those categories, then you're going to need to talk to your vet about the appropriateness of that. Now, thankfully, atopic skin disease, and another thing I should mention about that, it's more of a problem in kind of adult to middle-aged dogs, if you like. So we typically see that come on at some point between 1 year of age and about 5 years of age, something like that. Now, some will be a little bit earlier and some will be a little bit later, but typically, if your dog has got a skin allergy, then they're going to start showing signs at that kind of age. If it's really, really, if they're a young puppy, they're not going to have a allergic kind of atopic skin disease. If they're an old dog, they've never had problems with itchiness, then it's not going to be atopic skin disease, or it's highly, highly unlikely to be atopic skin disease. So, that's another clue that might be what's going on. But from that point of view, the fact that we can't give Apoquel to younger dogs isn't so much of a problem. Now, Cytopoint is the new kid on the block, if you like, and that is targeted specifically for atopic skin disease. It's not really going to work for any other form of itchy skin. It's an injection. It's an injection that, depending on where you are in the world, depends on what the licensing says. So in the UK and New Zealand, and I presume Australia, although I'm not sure, we give a certain dose. It lasts for a month, and we give a dose every month as a matter of routine. Now, if you're in the States, and I'm not sure about Canada, and like I say, I'm not sure about other parts of the world, but certainly if you're in the States, I believe the label dose is actually a higher dose, and that works for 6+ weeks. And the idea there is that I think you either give it every 6 weeks, or you wait until there are signs that your dog is starting to itch again, and then you give that next dose, and then you can work out what the interval is for your dog with that dose. And do that way. But clearly your vet's going to tell you when your next injection is due, and is going to talk to you all about that. Now, that is a dog specific treatment. The Apoquel is licensed for dogs, but it can be used in cats, and it can be used very successfully in cats. It can do a great job. Something to talk to your vet about. It is a higher dose in cats than it is with dogs, but like I say, it can, be a very appropriate treatment for them, whereas the Cytopoint is just a dog-only product. Now, the Cytopoint is very clever. It's our first biological product that we have for pets, certainly one that's licensed. And what that means is actually it's an antibody. We're giving an antibody. So that is a naturally occurring product. The amazing thing about it is that about 90% of it is just a dog antibody. So it's something that your dog is going to produce themselves potentially, or could in theory produce themselves. And then just the final bit, the bit that actually binds onto what it's designed to bind onto, is from another species. Now, I think it's a rodent, but I'm not 100. I can't remember off the top of my head. But anyway, it's incredibly clever. But really what this means is that there's not really any kind of side effects we need to worry about. a very small, tiny percentage of dogs, I think it's like 2%, will develop immunity to the product, if you like. So the body's own immune system will attack and destroy the product. So it's going to be ineffective, but it's not going to cause any other problem than that. So anyway, fantastic treatment, specifically designed for atopic skin disease. And then we'll move on to, so there's other things that we can do. Let's talk about that. Right. So other things that we can do to manage atopic skin disease, because it's not all about drugs, and it might be that your dog actually doesn't, and your cat, if they've got an allergy, they don't need any of these medications. So maybe they need the steroids or the Apoquel or the Cytopoint or the Atopica or whatever it is in the short term to control that flare up. But there are definitely other management things that we can do, and that we should be doing, to make either the dose that we need to use less, or to allow your pet to be maintained itch free without needing these drugs, because they are expensive. That's the downside of the newer drugs, certainly the Cytopoint and the Apoquel. They're very expensive drugs, especially if you've got a big breed dog. For small breeds, it's a little bit more affordable, but unfortunately, as you know, if you've got a big breed dog, medication costs can really mount up, and these drugs aren't cheap, although for a dog that's miserable with allergies, they're worth every cent, in my opinion. But there are definitely other things that we can do. So we want to be avoiding other causes of itch. So this goes back to things like flea treatment, making sure that's well controlled. If you've got a tick problem, tick bites can be irritating when the tick falls off. They can also cause disease, so we want to be controlling ticks anyway. Reducing dust mites in your pet's environment. So, if they're just in the house, then you're going to be just doing the vacuuming and everything like normal. Washing the bedding though, very regularly. If they're in a kennel, making sure that's all cleaned out well. Patrick, I have a £6 cat. Can't imagine treatment costs for a £60+ dog. Yeah, it can get crazy, and I wince as well when I see this cost. Oh, look who we've got here. We've got Molly. She's come to join us. So I don't know. Can you tell the difference? She's a bit puffier and she's also lighter. But anyway, you're wondering what's going on as well, aren't you? So there we go. That's both of them. So that's all we've got. We've got 2 cats. We don't have any dogs or anything. It just doesn't, we wouldn't be able to walk them and look after them as we would like, although I grew up with dogs. So a couple of cats, they're fantastic. They're great with the kids. Anyway, where was I? Costs are really high for big dogs. But anyway, there are other things that we can do. So controlling dust mites, if possible, that's if you've got a dog in a kennel, making sure that's easily cleanable. It's not got all these little nooks and crannies. Storage mites is another problem. So that's in food. So especially if you're feeding a kibble based food, which a lot of us are, nothing wrong with that. In my opinion, I feed Millie and Molly a kibble. They're perfectly happy and healthy. But if your dog or cat's allergic, then if you're storing that for longer than ideal, for longer than about a month before you're finishing a bag, then you're going to get an increased level of storage mites. If it's not airtight, if it's not in a cool, airtight, kind of out of the light container and location, then also you're going to get more risk of storage mites. So just changing that storage might make a big difference in the itchiness for your pet. I've got reducing pollen exposure. Now that's going to be really difficult. You can't go and chop down every willow tree in your neighborhood if that's what your pet's allergic to. But something to consider, maybe if you've got an air conditioning unit or whatever that you're using to filter the air, making sure that the filters on that are cleaned regularly as well. If you know that particular food triggers your dog, and I'll come on to food allergies in just a bit, food triggers your dog or cat, and Patrick, this is for you especially as well, then, trying to avoid that. Now, I know you're trying to work through, what that is, but if if you've worked out what it is, then avoid that at all costs, because it can just take one mouthful to flare, to cause a flare up. Recognizing that a skin infection is developing, because our dogs with allergic skin disease, they are much more prone to skin infection. So a big problem is that you'll get an increase in that level of staph infection, or the yeast infection, the fungal infection, the malassezia. And even if you're then controlling the allergy, you've got this infection which has already kind of been set up. You need to treat that, get rid of that, to then get that itch resolved. Now, so just recognizing that, and that can be with regular shampooing and all that kind of thing. So that's another thing that we can do. We need to try and optimize our dog, and dogs specifically, I mean cats as well, if they do have a greasy skin, if it's scale, but washing a cat is a lot harder. I certainly wouldn't like to wash mine, but it may be something that needs to happen. But dogs specifically, we can wash their coat. That serves two purposes. It will help if we're using a medicated shampoo, if we need to. It will help actually just control and eliminate that infection, but it also has the action of washing out any pollens, any allergens that have collected in the coat next to the skin. It washes those away, and so it just reduces that allergic stimulation. The best shampoo to use, that's going to depend a little bit on your, what's happening at the moment. So like I say, if they've got an infection, then a specific medicated shampoo is what's going to need, is going to be likely the best thing to be given. So talking to your vet about that, and you'll probably be aware of what that is. If they've got particularly greasy coats, there's no infection, but they do have a greasy coat, greasy skin, or lots of scale, kind of scurf dandruff, then different shampoo might be needed. If they're just having a real flare up of their allergic skin disease, there's a couple of different shampoos. So there's Allerderm and Duoxo Calm have been shown to reduce that level of itch just because of what's in that shampoo. It's got kind of an anti-inflammatory, anti-itch effect, and that's been shown. If it's just a general maintenance shampoo, then you kind of want to avoid soapy shampoos. Use an oatmeal based one. They're much more gentle on the skin and on the coat. They're not going to strip out all the oils, because you don't want to strip out all the oils and really dry out the skin, because that then becomes a little bit like a psoriasis in us. A dry skin is an itchy skin, so we don't want to do that. But just using a good quality like hypoallergenic oatmeal based shampoo is what you're going to want to be using. And you're not going to want to use these other ones because they're going to be more expensive. So just an oatmeal shampoo is going to be a bit cheaper for you to use as a maintenance shampoo, because costs can add up. Excuse me. Cleaning also we need to talk about ears as well. So like I said, ear disease is a common sign that there is an allergy going on. So if your dog is getting recurrent ear problems, and I think I spoke about ear problems last time or the time before that, but just regularly cleaning out your dog's ears, maybe once a week, every couple of weeks, using an ear cleaner, get rid of wax, help remove any debris down there, help kind of dry it out and reduce inflammation, so it helps prevent an infection taking hold. Now, anti-allergy medication, so we've talked about kind of those big ones, but antihistamines, so Georgie, antihistamines can play a role. So there's a number of different antihistamines. Now, the difficulty with antihistamines is that their action is quite reliable in people, in us. So if we've got hay fever, then often an antihistamine is all we need to take to really help with those symptoms. With dogs, unfortunately, it's not quite so simple. So only a proportion of dogs will respond to a particular antihistamine, and that response isn't common across all antihistamines. So it might be that Piriton does a great job and you notice an improvement in your dog with Meg, and if you do, fantastic. But it might be that it's only about 20% of dogs, I believe, will respond to antihistamines or to a particular antihistamine. So it might be a case of needing to try different ones. They can play a role, but they often aren't the best if they're just used by themselves. Now, if you're doing all of these other things, it might be that the antihistamines, just takes your dog over the edge to stop itching. But yeah, we shouldn't, in my opinion, we shouldn't rely on that as the only thing that we should be giving for itchiness. Excuse me. Now, another treatment that we can use in Georgie, again here, because you say that Meg always itches on the same place on the back of her hip area or on both sides. So again, we want to be checking that there's not anal gland problems there if that's what your dog is doing. I'm sure, Georgie, your vets check Meg's anal glands. But if they're always itching one spot, and also, arthritis as well, if they're itching one spot. So for example, hip problems, if it's, especially if it's like a Labrador who are prone to hip disease, then hip problems can be, arthritis is pretty common, hip dysplasia is common, and that could be that licking those particular spots, and only those spots could be a sign. But for dogs that are allergic, and it's dogs specifically here again, really, we can use a drug whose name completely escapes me. It'll probably come to me in a little bit, but it's a topical steroid spray that it gets broken down in the skin, so we don't tend to get the systemic effects of the steroid. So it's not like another cream, and there are steroid creams that we can give that will have the same effect, but they do get absorbed, and they will potentially even have effects with the rest of the body, especially if you're using it long term. But this drug, and I can't remember what it's called. Let me just jump on Google here. Topical dog skin pump. What's it called? It's called, it's not coming up, of course, it's not, Cortivance. There we go, it's Cortivance spray. Or nothing like being put on the spot, is there, and your mind goes blank. So Cortivance spray is what it's called. And you can use that, so you give a pump, and depending on how big that sign is, how big that size is, depends on how much you use, how many pumps you need to use. But that can be a fantastic way of really tackling a localized itchy spot caused by an allergy. So I'm honestly clueless. She can go months with no itching, then it returns. You mentioned hormonal, and I think it may be, well, it certainly is. She isn't spayed because she has silent seasons and vet isn't happy to spay her. Well, I guess that's another topic. I think, we can spay a dog, female dog, when they're in season. It's potentially a little bit riskier. There may be other reasons, Georgie, why your vet doesn't want to do that. So, I don't want to contradict them, but yeah, and probably spaying isn't going to be related. So hormonal things, I'm thinking maybe hyperthyroidism in cats or a hypothyroidism in dogs. Certainly Cushing's disease, sorry, and almost had another mind blank there. Cushing's disease, so hyperadrenocorticism, can potentially cause skin disease and itchiness, although that is an increase in steroids, so you might get kind of skin lesions without itchiness. And then, yeah, there are other hormonal problems that can cause that. So, yeah, something to think about. And blood tests can be run, but this is an example, a classic example, Georgie, unfortunately, that of why skin disease can be incredibly frustrating, because there are tests that we can run a lot of tests and they can come back either negative or inconclusive or not sure or may not be. There's often a big grey area. And so it can be frustrating. And Georgie, I wonder if, and this is another option, if you are at your wit's end, and this goes for vets as well, is actually referring to a specialist dermatologist. So all they do is skin disease day in, day out. It's going to give you the best chance to actually getting everything under control if you're struggling with everything else that's going on. But anyway, Cortivance, yeah, is a particular problem. And yeah, Georgia, I wonder as well, so with allergic skin disease, with atopic skin disease specifically, that is seasonal, or often starts off as being seasonal. So it will be for maybe a few weeks or a month or so in spring, for example, and then may come back in autumn, just when we're at kind of high pollen counts and things like that. Often as dogs get older, not by a certain stretch by any means, but that will go from being, a short period of time, that period of time will getting longer, to being a year-long problem. Unfortunately, that's often the case, especially with our Westie and all that kind of thing. So, yeah, something to think about there. Now, diet. Now, I've already touched on diet when it comes to grains and other things, and we'll talk about that again when it comes to food allergies. I mustn't forget to do food allergies. You'll have to excuse me, I'm kind of losing my voice a little bit. I'm not used to talking non-stop we've been going for over 45 minutes, nearly 50 minutes. But diets can play a crucial role in allergic skin disease and skin disease as a whole. So another problem that we get with skin disease, and one way to think of the skin in a dog who has got allergic skin disease, is like a brick wall, but an old brick wall. So the mortar between the bricks is flaky and there's gaps. So we could think of the skin a little bit like that. So the gaps between the cells, so rather than really nice and tight, they all become a little bit kind of like that. And that's when the allergens, the things that we're allergic to, can get through those into the skin effectively and cause that allergies. Now, skin diets can play a crucial role in tightening up those gaps and reducing or eliminating those gaps. They also can have an anti-inflammatory effect. So we can give, they're often rich in omega fatty acids or omega-3 fatty acids, and they really need to be from a marine source, so a fish oil, effectively, rather than a flaxseed oil. And I'll come on to that in a little bit as well. They'll contain zinc, they'll contain lots of other things as well. That can make a huge difference. So these are diets that are proven. So I'm thinking of diets, something like Derm Defense, proven to reduce itch in dogs with allergic skin disease. And again, if we can do all of these things, it might really reduce or eliminate the need for ongoing medication, which I don't have a problem with giving, but if we don't need to give it, fantastic. So we definitely can think about giving an allergy-specific diet. Now, if your dog's got a food allergy, I'll talk about that in a minute, like I say. Other things, if you don't want to feed a food-specific, an allergy, skin-specific diet, then we can give supplements. Now, this is where we come into fish oils. Now, a lot of people will give flaxseed oil rather than a fish oil because it's sold at their vet clinic, which it may well be, or it's sold in the pet shop, or it's marketed wherever it is in the supermarket as helping with skin disease. The reality is, though, is that dogs can't process the essential fatty acids in flaxseed oil and any other kind of plant-based oil to have the anti-inflammatory effect to what's needed and what's present in fish oil. So flaxseed oil is much cheaper because it can be grown in vast amounts. It's it's easier to produce, but it's really not effective, not at all, or if at all. Maybe it has a slight effect because of other things, but dogs cannot break it down as the bottom line into what's needed and what has the biological effect. Fish oils, on the other hand, are unfortunately more expensive, but they will help with inflammation. They really do have a good anti-inflammatory effect. And so this goes for arthritic dogs as well. So not just dogs with skin disease. Fish oils are fantastic. And, cod liver oil is the classic one, isn't it? And it's, what's said to be good for our health. Yeah, they're really valuable for health in general. Excuse me. So these will be in skin diets. Cats too. Yes, I believe it is. Yes, I believe it is. I will double check that for you though. I guess we don't tend to, because allergic skin disease as such is much less of a problem. We don't tend to, in cats than it is in dogs. It's not something that I will often recommend. And I believe fish oil is going to be superior anyway, but it might be that cats can break it down. Although actually it's often cats who, when it comes to different medications and things, they do break things down and process things in the body very differently to dogs. So I imagine it is, but I will double check that for you and get back to you on that if that's okay. So we can add fish oils. Now these are going to be in different supplements. Obviously there's just kind of cod liver oil. They will be in different supplements again with arthritic problems. And if you've got an older dog who's arthritic, then it's likely that will already be supplemented with our fish oils. But it can be cod liver. So cod liver oil is a classic one. Salmon oil, krill oil, our green lip mussel extract is another common one in joint supplements. But it really needs to be an oil from a marine source. There is a specific dose for that as well. And there might also be reasons why it's not appropriate for your dog. So I definitely encourage you, or your cat, encourage you to talk to your vet about what the most appropriate one is for your pet, what dose you should be using and whether it is appropriate. Now, if you are just getting something off the shelf, choose a dog or a pet only one, because human ones are fine if it is just the fish oil, but a lot of them, or some of them, will have added vitamins, added kind of oil soluble vitamins that can be get to toxic dose levels if we're giving them to our pets. They can also contain sweeteners to make them more palatable for us, and the sweetener here that is a concern is xylitol, which is massively dangerous for our pets. Like one piece of chewing gum in sugar-free chewing gum that contains xylitol can kill like a 20-pound dog. Hi Gabe. So yeah, xylitol is really dangerous and can be in some human fish oil preparations. So definitely I'll be talking to your vet about that and getting their recommendations about how much to give your pet as well. And then the final thing that I've kind of touched on as well with treatment for allergic skin disease and atopic skin disease is actually blood testing and then allergy shots. So having a vaccine produced specifically for your dog against what they're allergic to. Now that is a long course of treatment, multiple vaccinations effectively, and it's something that's produced specifically for your dog. But it's kind of the one thing that we've got that has the potential to cure your dog from their allergy. So that's something to talk to your vet about. Again, it's pretty expensive. It's a long-term commitment, but it may be that it's the right thing for you, for your family, and for your dog as well. So that's kind of the final kind of way we could go about treating atopic dermatitis. So the last thing I want to talk about before I lose my voice is food allergies. So food allergies, I don't think they're really as common as maybe people make out. There definitely is going to be a subset of dogs that do have a food allergy. Now, food allergies is probably the most difficult thing to diagnose because blood testing is useless. Now, you'll see on the internet, you'll see blood tests, you'll see hair tests, you'll see loads of different things and people claiming that they're great at telling what food, what protein or whatever it is, what carbohydrate your pet is allergic to. Don't waste your money. They're not very good at all. They cannot be relied upon. No matter what what people say, and yeah, you'll read all kinds of claims about vets just trying to rip you off with food, and it's easy to diagnose. It's not. Don't waste your time on blood testing, skin and hair testing. Certainly at this point in time, it might be in the future that we do get a much better test for it. But really, the only way to truly diagnose a skin allergy, a food allergy, is to do something called a diet trial. And Patrick, this is what you're kind of going through at the moment, but yeah, it's something to talk about here, definitely. So there's a few things that we can give, a few different types of diet that we can give. Now, the first type of diet contains what we call a novel protein and a novel carbohydrate source. So that is a protein and a carbohydrate that your pet has never eaten before. Now, this is actually really challenging because especially if your dog has been fed a lot of variety in their diet, or they're just fed a stock standard pet shop food or supermarket food that often will have a lot of different things or potentially contamination. I mean contamination by containing different proteins than maybe the ones that they specify particularly on the label. It can be very difficult to find something, but an example would be like fish and tapioca, or I don't know, tuna and rice, or whatever. But that's really difficult. But if you know what your pet has always eaten, it may be something that you can do. In my mind, though, the best type of diet is something called a hydrolyzed diet, and what they do here is that they break down the components of that diet into much smaller pieces. So if you like, they take a chicken protein, which if you like is this long, then they actually break that down into lots of different sized proteins, so into much smaller components that aren't then going to trigger an allergy. They're smaller than is what's going to trigger an allergy in your pet. So that's called a hydrolyzed diet. An example of this would be Hill ZD. Again, they are a bit more expensive because of the technology that's gone into produce these. But that way you can kind of work around the fact that you don't know what your pet's allergic to, and they've had a whole load of things. So prescription diet. So yes, they're only prescription diet, but prescription diet is kind of a bit of a marketing term in the sense that they're designed for specific conditions. So prescription diet, you wouldn't just be feeding just because you fancied feeding something different to your pet. You're feeding it because your pet has got, or you suspect they've got, a specific condition. So it doesn't need a prescription to buy. You can buy it online. You can buy it at your vet. You can buy it. It may be in other places. So you don't need a written prescription, I guess, is the bottom line. So it's maybe a little bit of a marketing term, but also it separates those from just your bog standard diet. So if it's a prescription diet, you don't want to be feeding that just because your pet's healthy and you just think that they would do better on a different diet. There's other kind of diets that you can look at. So so ZD would be something, and that's one example. There are different examples from different manufacturers, obviously. So that's one thing. So we need to be feeding a specific diet because it's very hard to, and if you're wanting to just remove chicken, for example, from your diet and you're just looking at the label. Now, unfortunately, because how diets are typically made, they're made in batches in factories, and they're going to be made in factories that are producing lots of different diet types with different ingredients. There is the potential there for cross-contamination, and you only need a really small amount in the diet to trigger your pet. So even if it says it's chicken and it's got no beef in it, if there's been beef made in that factory and they haven't cleaned it exceptionally well, which most diets don't need, the machinery doesn't need to be cleaned as exceptionally well as that, because it just doesn't. Then you're going to struggle to find that novel protein diet. So that's where the hydrolyzed diets come in. But the other problem with doing a diet trial is actually just the time it takes. So you have to feed that diet, so the ZD is an example, and nothing but that diet for 8 to 12 weeks. So that's a really long time. If you've got other pets in the house, really you're going to have to feed them that diet, because if your dog or your cat and again, it is more of a dog problem, but if your dog or your cat gets hold of a mouthful of something else, if you're doing really well and someone gives them a sausage treat, it could be your vet if they don't know that you're doing a diet trial. If you're going to a new vet, and they're allergic to pork, then that's going to trigger that's going to just knock you back to square one. So you need to be really vigilant that you feed that diet and nothing but that diet. And water is the only other thing that crosses their lips. Now, there might be other things, kind of like vegetables are going to be fine. But anything protein or carbohydrate you need to avoid. So that's where it can be really challenging, because that's a really long time. Like 3 months is a long time for your pet not to get anything else. So yeah, you have to be that strict. So, kind of labour that point. But if you're not going to be that strict, or if you're not going to be able to be that strict, and if your cat's outdoors, then, your neighbours might be feeding other, you might have a lady down the street or a man down the street who is puts food out for stray cats, or they've got a bowl of cat food at the bottom of the garden to feed the hedgehogs, or whatever, and you're just not going to know. So it can be incredibly challenging. If you've got an indoor cat, clearly that's going to be helpful, but also if you've got a dog who's out and they're on the playing field walking and someone's dropped their treats and they get that, it's really difficult. But that's the only way that we can go about diagnosing it. And then the complication is that there is going to be a small subset of dogs who will need to have a couple of different diet trials. So if they don't respond to one, the chances are they don't have a food allergy. But there's a small chance that they do, and they've just reacted to that diet, although in theory they shouldn't. And so you could try a different one. But anyway, so that's that's allergies in a nutshell. And that's kind of causes of itchiness in dogs, and all of the things that we can do to treat them and to get to the bottom of it. I'll say it again, it's frustrating. Skin disease is incredibly frustrating. We seem to control it. And the other thing, I guess, the final thing to mention is that it does fluctuate, especially allergic skin disease. So you will have episodes, even when everything is really nicely controlled, you're doing everything, it seems to be settled really well. You'll get episodes where it does flare up again. And you need to then jump back to maybe giving antibiotics or antifungal because it's flared up because your dog or your cat has developed an infection, or the pollens are just particularly bad that year and the stimulation is just overriding the treatment that you're given. But it's also something to bear in mind if, with all of these other things. So, for example, flaxseed oil, it might be that you saw a benefit when you gave it. But the reality is that we know that dogs can't break it down. So it's not going to be flaxseed probably isn't going to be helping. But if you started that when your dog was kind of at their most itchy, well, they were going to get less itchy anyway because it naturally fluctuates. So we can then wrongly assume that it was that intervention that caused that improvement rather than the fact that it was going to improve anyway. And that's a topic for another day, maybe, is like evidence and how you can be sure that things are working. That's a phenomenon called regression to the mean. But anyway, that's something to think about. But it's definitely something to consider if you're looking for miracle cures. And unfortunately, there's lots of things online that will say it definitely helps. I'm going to jump in here and say homeopathy is another thing that relies on this regression to the mean, amongst other things, caregiver placebo, for people who claim that it works, because it doesn't. But we need to be careful, because I don't want you to waste your money on things that don't work. So yeah, I'll elaborate that on another video. Absolutely. So I've talked about some of these things, Patrick. If you have a little look on the YouTube channel, I will leave some of those links in the description as well. But maybe we'll talk about that in another live stream as well. That's going to be a controversial topic if we've got some homeopathy fans in the house. But yeah, the bottom line is I don't want you to waste money on things that aren't going to work. But for those people who say, well, we need a holistic approach, well, what I've just described absolutely is a holistic approach, because we're controlling diet, we're controlling the environment. Holistic approach does include using pharmaceuticals as well. We don't rely on them. We don't want to use them unnecessarily, but they have a fantastic job. So this is what, and I'm getting on a rant here, but holistic has been hijacked by a lot of the alternative practitioners alternative people who, crystal healing, whatever, to say they're practicing holistically, and normal vets aren't holistic practitioners, which is a load of rubbish. We all want to work through this system, but we do use pharmaceuticals when we need to.
Wow, so that was a huge topic It's a big topic covered in a little over an hour. So I know that's a long time, but sometimes it's worth taking the time to really deep dive into these topics so you get a full understanding of everything that's involved. Because sometimes if we're only looking for kind of small snippets, we fail to see the whole picture. And so we don't necessarily do everything that we can to make as much difference as we can. So I really hope that this helps you control your dog or your cat's itchy skin. It's a big topic, like I say, and it can be incredibly frustrating. But tackling a few of these things that I talk about can really make all the difference, and definitely taking a proactive approach rather than burying your head in the sand is what's needed. Work closely with your vet, take the time to make the changes, and I'm sure you'll see good results. So remember too that you can check out other live streams like this over in the Our Pets Health Academy. They're all designed to really optimize your pet's health, take their health to the next level so they can live as healthy, happy and full a life as possible. You can find out more details of that over at ourpetshealthacademy.com. You can also get your question answered to feature on an upcoming podcast episode by heading over to callthevet.org. And until next time, I'm Dr. Alex. This is the Call the Vet Show. Take care.
You've been listening to Call the Vet. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show that answers all of your pet questions.